I am Dr. Swarupa Mitra from Rajiv Gandhi Cancer Institute and Research Center, and on behalf of Healthy Ho. I am here today to talk about cancer cervix. So it is for us to know about cancer cervix, it is for us to know how to prevent from cancer cervix and also the treatment of cancer cervix. So I'll try to explain all these things in very simple words so that it is easy for everybody to understand. So what is cervix? The cervix is the lowermost part of the uterus, that is the mouth of the uterus, that is the lowermost opening of the uterus. This is often called as the mouth of the uterus. So the cancer which occurs or starts from here, that is called the cancer cervix. It is very different from the uterine cancer which appears from the body of the uterus. So cancer cervix, why are we talking about this cancer? Because it is one of the commonest cancer, not only in India, in the Asian countries. So once upon a time, or maybe about 10 years back, it used to be the commonest cancer in India, but over the last 10 years it has become the second most cancer. But I believe in rural areas it is still the commonest cancer in females. So what are the predisposing factors? Why do some people get cancer cervix and why not the others? First and foremost, which needs to be remembered, is the hygiene. The local hygiene, your menstrual hygiene, the hygiene of the genitourinary area is very, very important. Your immunity, one has to have a good immunity. That means if somebody is suffering from long ailments, if somebody has diabetes and other comorbidities, their immunity is less. So such people or such ladies are more predisposed to get cervical cancer. Third is the safe sex. Multiple sexual partners and not following a safe sexual practice is a very important factor for developing cancer cervix. Others are your smoking habits and not having good food, not having proper rest. So all these things, all these factors are risk factors for developing cervical cancer. What causes cervical cancer? Now, cervical cancer generally, it is a bone, probably it is caused by a viral infection. Now this virus is called as the HPV or the human papilloma virus. So this virus infects the cervix of the uterus and then it may lead on to cervical cancer. Now let me tell you here, all HPV viral infections of the cervix are not cervical cancer. Only a few minute of them may develop into cervical cancer. Most of these HPV infections, they get cured on their own because of the immunity of the lady. So that is why getting a proper immunity, having a proper immunity is very important to fight this cancer, not only this cancer, any cancer. Coming to the signs and symptoms of cervical cancer. Most of the time it may not have any symptom, and that may sound very scary, but yes, many times the early stage cervical cancer, they may not have any symptoms, but there are some symptoms which you should not neglect. First is for young women or middle-aged women, post-coital bleeding. If you have a bleeding after having a sexual intercourse, you should go and visit a doctor. Second is irregular bleeding. Irregular bleeding means having a bleeding between 2 cycles or after the menopause. After a menopause, if a woman has bleeding, it should be taken again seriously and she should visit a doctor. Other than this, one may not have bleeding at all, but there may be very foul smelling discharge, serous discharge from the cervix, and then once again, please do not neglect it as an infection and take antibiotics. Once again, do visit the doctor. So intermenstrual bleeding, postmenopausal bleeding, post-coital bleeding and any vaginal discharge, they should be taken seriously. Others which are less common probably in early cervical cancer is lower abdominal pain, pelvic pain. So these also, if it happens, they could signal some cervical cancer history or problem. Now what do we do about it? So let us first talk about the prevention, because cancer cervix is one of the most preventable cancers that we know of. So that is why most of the times, many times, it is called as a preventable tragedy. Now, how do we know? How do we prevent ourselves? So for this, we need to know a few things. Now, the first is that a HPV vaccination. Since it is a viral infection, so there has to be a vaccination in most of the cases. So is cancer cervix. There is a vaccination, and please do avail it. It is available everywhere in all government sector hospitals and clinics, and also private clinics. And there are two accepted cancer cervix vaccines. So one is the Cervarix, other is the Gardasil. So you don't need to go to the details of it, but both of them are very, very effective, between 90 to 99% effective. Now, these vaccines are given in 2 to 3 doses as your doctor recommends. They are generally given intramuscular, they are given inside the muscles. It is just cause a slight pain. There are not any side effects which are commonly noted. Now, these vaccines should be taken, of course, under the instruction of a doctor. Now, after the vaccines, this does not mean that you should stop your awareness tests or the screening tests. So this brings me to the topic of screening tests. So cancer cervix is a screenable cancer like breast cancer. How do we screen? Now, what is screening? Screening means detecting a cancer before it produces any symptom. So cancer cervix is a screenable cancer. So for this, we have a very simple test, which is the Pap test. A Pap test and also the HPV DNA test. So in our country, Pap test is easily available, and it is cheap and free of cost in most of the times. So Pap test should be availed by all women. Now, Pap test, it is a test which is again very simple. It can be done in the OPD. It is painless. The sample is taken from the uterine cervix, and it is seen under the microscope. That's all. It is seen under the microscope for some abnormal cells. A HPV DNA test is also done with the same sample, and here the sample is looked for any infection with the HPV DNA. So both these tests are very simple and easily available. So after this, these are the preventable steps that one can take to detect cancer early and also to prevent it. Now, talking of those risk factors which we were discussing, so these are the risk factors which actually prevent cancer if you take them into consideration in your life. So first of all, your immunity. Have good food, have proper rest, and if you have any diabetic or hypertension, any such ailments, then please get them treated. So this way you can improve your immunity. The second is that you should know about your sexual life. You should practice safe sex. Try to avoid multiple sexual partners, follow a protected sex. Others are, of course, your DNA vaccination and these screening tests. Now, what happens if cancer cervix is finally detected? So if you are following the screening guidelines, so probably the cancer of cervix can be detected very early, and in the first and the second stages they are said to be almost 100% curable. The treatment is easy, the treatment is not expensive, and once again it is one of the most curable of all cancers. We have seen cancer cervix patients who have lived for 15, 16, 17, even 20 years without any complications and without the disease coming back. So that is why it is all the more very, very important to detect this cancer early. And how do you detect it? You detect it with the screening test, that is the HPV DNA test and the Pap smear test. And this is a preventable cancer. How do you prevent cancer? By the HPV vaccination, by following safe sex, and by improving your immunity and hygiene.
और हेल्दी जानकारी के लिए लाइक करो, शेयर करो, सब्सक्राइब करो हेल्थी हो।